In Uganda, most people actually have access to some form of primary care. But over 5 million people living in remote rural regions have no access to healthcare facilities. Each year, over 1 million people living in these healthcare black holes are suffering from the deadly condition of malaria, which can be treated with just a handful of medication. At OneDay Health, we launch high-quality primary care centers in these healthcare black holes so that no human dies of malaria or any curable disease. We go to market with a standard process. We first map these healthcare black holes, areas where communities are over 5 kilometers away from the nearest healthcare facility. We then train our talented young nurses in our WHO-mandated standardized training protocol and equip them to provide the local community a comprehensive primary care package. And then we load onto a truck the solar unit, the equipment, the diagnostics, the medication, and head out into the black hole. And on that very same day, our nurse begins treating patients with conditions such as malaria. We move quickly. In our first 6 months, we set up 10 health centers and have already treated 30,000 patients till date, over half of whom are children under 5 years old. We have saved local communities over $30,000 in medical costs because they no longer spend large amounts of money traveling to distant healthcare facilities. We're also empowering a local community of exceptional nurses and setting them up for future success. So how does this all really work? We are able to provide high-quality care at under $1.50 per patient because we rent spaces, work with local young nursing talent, and use efficient WHO treatment protocols. And best of all, we are a sustainable healthcare solution. The unmet need for quality healthcare in these remote areas is so high, the cost of running these health centers is entirely covered by patient fees alone. At just $4,000 to set up, each health center treats over 2,000 patients a year. Over the next 3 years, we will be launching 100 health centers, and then ultimately, we will fill every healthcare black hole in Uganda with a OneDay Health center. So that one day, every human in Uganda will have access to high-quality, affordable primary healthcare. Thank you.